Good morning, it's Jaya Calder from Hi, and it's great to have you with us for our latest NEXUS webinar, which is entitled NHS Highland Navigate Urgent Cancer Care with Video Technology. Now, before I pass you on to my colleague Andrew McCall, I'd just like to spend a minute of how we'll run today's webinar. Although as an audience you're automatically muted, we've got a couple of ways to get you actively involved. Use your question box at any point throughout the webinar and we'll pick up as many as we can during the Q&A. You'll also see an icon called the raised hand icon, and during question time, if you've got a mic and you want us to take you off mute to speak directly with our panel, then just click on that icon and we'll get you connected. And finally, we always want to promote knowledge sharing and collaboration, so we record every session, but we're happy to share the recording and presentation afterwards. So that's all from me now, and I'll just pass you over to my colleague Andrea to introduce today's speakers. Andrea.
Thank you, Jaya. Welcome, everybody. As Jaya said, I'm Andrea McCall. I work in the Life Sciences team at Hi, and I look after the NEXUS co-working space on Inverness campus, which is a collaborative space for life sciences and technology companies. So this NEXUS webinar series is just a way for us to highlight things that are going on in NEXUS and on the campus and around about, and connect people who are in the life sciences and technology space or would like to be. And the project is funded through the Northern Innovation Hub, through the Inverness City Region deal and ERDF funding. So without further ado, just to introduce our speakers today, I'm delighted to have Lesley and Reece here with us today. They work for CorporateHealth International, which is one of the companies that is based in NEXUS. And they are growing very rapidly. So they have 11 people working for them in total already, and are looking to get another 5 on board very soon. So that's great news for us to see, you know, a local company kind of growing rapidly, and they're here today to share some of their story and some of what they do. So delighted to hand over to Lesley first to go through the slides, and then hearing from Reece later on before we go into the question and answer session.
Thank you, Andrea. My name is Lesley Patience, and I am by trade a nurse. I did my training down in Aberdeen, and I started working for Corporate Health after working in Reece Moyes Hospital as a nurse practitioner for many years, and then doing some research with the clinical research department over there in NHS Highland. So I work as the nurse consultant for Corporate Health, and I'm also the UK operations manager. So who else do we have in the company? So if you have a look at the slide here, we've got Hagen Benzek, who is our Chief Innovations Officer, and he's based in New York. We have Cornelius Glisman, who is our Operations Manager, and he looks at all the HR and finance of the company, and he's based in Germany, and they're both the founders of the company. We have the team of nurses in the middle, which is rapidly growing because we're about to roll out through the whole of Scotland, and I'll explain a little bit about that later. We have Reece Moyes, who you'll hear from in a little while, and Reece is our data engineer. And we have Ilya Magdenko, who also is our software developer, and Christine Gazjul, who works with our accounts and all our finances with all the projects that we work on. And we're all based in our headquarters in Inverness, which is at Solasta House. So our aim is to eradicate bowel cancer by making GI diagnostics accessible to all. And we do that by a team of nurses who deliver the process throughout the Highlands at the moment, and we have a central reading centre in Germany where we do all the pre-reading, and then those pre-readings are then sent to our GI consultants who are based in Edinburgh to sign off those readings before those reports go back to our consultants in the NHS Highland at the moment as well. So telehealth is huge for us, and obviously logistics is a huge part of what we do as well. So we operate across the whole of Europe. We have a managed service in Greenland. We do private reading for providers in Sweden. Our main central evaluation and medical leadership happens in Germany, and also Cornelius is based there as well. In Denmark, we have run multiple clinical trials. There's a lot of remote assistance and expert trainers there, and we have 4 nurses in Denmark as well who deliver the service in Odense. In the Netherlands, we have clinical trials and delivery for transformation and preparations. And Barcelona in Spain is where our AI partnership is based, and Reece will tell you a bit more about that at the end of the presentation. Down in England, we've got some digital health partnerships, and we're about to start working with 4 or 5 of the health boards down in England as well to roll out capsule endoscopy down there. And here in Scotland, we've got our hub in Inverness, our main hub here at Celesta House in Inverness. We have an NHS pilot sites, which we did basically back in 2016 for 2 or 3 sites in the Highlands. And we do small bowel capsules in the Highlands as well. And we are now a sort of bit of a research centre, and we've been looking at this service evaluation for the last year. So the principles that define our operation. So we're looking to create services that scale. So it's looking at what services are out there and how can we manage to scale those up fairly rapidly and with a good standard of care. As nurses and with our processes and delivering to the service to the patients, we aim to do that to the highest standard. We like to have a gold standard of care. It's all about building support and IT infrastructure to make those services scalable, and that's where Reece and Elia come in. And even as nurses, if we find something that we're finding is a bit onerous, that we're writing several times, we try and look at software solutions for that to make sure that things can be a bit scalable and we can take that time off and make things a bit more economical, I suppose, and efficient. So we work locally and internationally at the same time, and we're really happy to work collaboratively with both public and private entities. And that's one of the parts of jobs that I love, is that we still work for the NHS, but we also do some work with private companies as well. And we are leading currently at the moment with some of our innovation in artificial intelligence and digital health, which again, Reece will explain a bit more about at the end of the presentation. So it's just about how we deliver our service, and it's about skillfully combining the people, the processes and the technology. And that's been a bit of a learning curve for me as a nurse, because technology is not something that we do a lot of when we're working with the patients. So we have local nurses that manage the patients, and that's what we do here. And then we have central nurses that do pre-reading, and they're based in Germany at the moment, but we are about to employ some more throughout the UK and have our own reading service, pre-reading service in the UK. We have consultants, so GI consultants, who evaluate those videos once the nurses have pre-read them. And once they sign those off and they're happy with those, that's when the report then goes back into the referring consultant within the NHS. And obviously we have the IT to support the teams and automate all the workflows and make sure that we can have that data exchange between ourselves, the NHS, or whoever we happen to be working with. So what is a video capsule endoscopy? So for those of you who don't know, I'm just going to go through a bit of what kit we use and how it works. So basically it's a medical device, and it can visualize the lower GI tract. There are two types that we use of the pill cam capsule at the moment, and we use the colon capsule here at CorporateHealth, but we also do the reading for the small bowel capsules that they use in NHS Highland as well and throughout. So that's a picture that you can see there of the colon capsule, because it has 2 lights on it, you can see there at the end. And that capsule is swallowed, and it takes up to 400,000 images of the colon. The bowel prep, sometimes the patients find a bit more onerous than they would for a colonoscopy. And that's mainly largely due to the fact that they have to have some what we call boosters the day of the procedure to help that capsule excretion. The patient comes in and has the process in a hospital or community-based GP at the moment, but the hope is that we will eventually, once the camera and the kit become a bit more amenable and a bit more user-friendly, that we could do that from the patient's own homes. Complications are very rare, and capsule retention is about 0.3% at the moment, I would say. And there's just a couple of pictures there just to show you how clear those images can be. So we'll just go into a bit about the equipment that we use. Now, the capsule has 2 cameras in there. For those of you who are interested in exactly what the percentages are and the technology of that, I've popped this slide up. It's something that I don't know a huge amount about. I know it has 2 cameras. It has some lights in there, and obviously the battery. The battery life is minimum 10 hours. Sometimes we get up to 15 hours from that capsule life. And the shelf life of the capsule is about 12 months. A lot of patients are really concerned about swallowing the capsule because it is about the size of a large antibiotic, but it's got a smooth special surface on it, and most of them manage to swallow it down, no problem at all. And I'd say on average from those that I've seen over 500-600 patients now, there's only been 2 or 3 that haven't managed to swallow the capsule. The patient also wears the belt, so the sensor belt, and that is the antenna basically that helps the movement of the pictures that the capsule takes to the recorder that you'll see in a minute. It is still a little bit bulky, and the patients will sometimes comment on that, but Medtronic are currently working at making that much lighter and slimmer. We do have a new prototype at the minute which we're trialling with a single-use cover on that, especially for using throughout the COVID period. The data recorder, as you can see, looks a bit like a Walkman. And again, Medtronic are currently working on getting this to look a bit more like a mobile phone. And the capsule transmits the data via radio wave to this recorder while the patient is wearing that. And the patient goes home with that from the clinic and returns it to ourselves the following day once everything has been completed and finished. And the battery life of the recorder is probably again around 15 hours, and it has to be fully charged after every use. So the Scottcap project, which is the one that we've just started kind of phase 2 of, so it was done as a service evaluation. So we started that back in July in 2019, and the first phase was completed in April 2020. We saw over 500 patients in 7 locations throughout the Highlands, and the main hub was here in Inverness. And it was really a bit of a service evaluation, and we mainly looked at surveillance patients, but also symptomatic patients, to see whether the patients liked it, whether it did improve the service, if we could see all those patients in a timely manner, how many patients would need to have a follow-up colonoscopy or flexible sigmoidoscopy. And I think a mistake that quite often is made with capsule is that it's here to replace colonoscopy, and that's not the case. It's another test that we can have, and it's probably more it can probably be compared more in the fact to what we use a CT colon for, because we can't biopsy yet, and we obviously can't do any of those things. And should we find polyps and things, the patients would still need either a flexible sigmoidoscopy or a colonoscopy to help to biopsy that for the patient. So with partners, we address the whole patient pathway. So we currently work with Medtronic, we work with EMS, Medilogic, who have developed the EMS system, which is an endoscopy reporting system, and we work with NHS Scotland. And we're looking at this to roll out throughout the whole of Scotland as a partnership. So it's all about selecting the right patients for the capsule, and at the moment we are seeing patients who we are well aware may well need further investigation, and that's really because of COVID. The ability for the colonoscopy units to see their patients, on the whole, they reckon between 60 and 75% throughout the whole of the UK has been the reduction in their capacity to see those patients. So we are seeing patients who are urgent suspected cancers and urgent patients at the moment, because it's a way of a triage system, so that when they get back into the NHS, we can triage those patients who are the biggest priority to be seen. So we prepare the patients, we deliver the procedure. Obviously our pre-reading nurses analyse the videos, and they're signed off by our consultants. And then the reports go back straight in from our system to the EMS system that sits in the NHS. And then once the consultant signs those off, they're automatically uploaded to their system called SkyStore, which is where everybody else can then, all the other doctors and GPs can see those reports, and they make the final diagnosis. So just to be clear, we as a company do not diagnose the patients, we do the reporting, and the referring consultant will make the diagnosis. So we've been working really hard on getting our patient information right as well, and we're looking for a Once for Scotland brochure or booklet that we send out to those patients. The Strathclyde University sent a questionnaire out when we first did our evaluation, and they collected all the information from that. And with some of that information, and from some of the information that Corporate Health ourselves had gained from patients in the past, we developed, in collaboration with Hilliard MacDonald, this really great booklet that the patients seem to really love. And this was a Corporate Health booklet. However, we have changed this at the moment to an NHS Scotland document, which is being looked at by the whole of NHS Scotland and a lot of the consultants throughout Scotland. And there are lots of changes that we will make to this to make it an NHS Scotland and a Scotland-wide document. But this is the document that we're using at the moment. And we've been working really closely with NHS Scotland and DHI to develop all of these things to make sure that we're ethically hitting everything correctly and making sure that we're covering all the legal and ethical guidelines, as well as making sure we have something that's deliverable and understandable to the patient. So I've popped on a couple of websites there, just for those of you that are interested to have a look. So there's quite a lot of information on NHS Inform, and also DHI have added some bits and pieces to their website about how we do our process and what that process involves. So obviously we were a bit of a pause when COVID hit, and we weren't allowed to see any patients, because we do see the patients face to face and in clinic. And that probably lasted 2 or 3 months for us. And then we were allowed to restart seeing patients, obviously because a lot of the urgent suspected cancer patients could not have a colonoscopy. And it was really important that we started some kind of way of triaging them and seeing those patients. So we had a lot of discussion with obviously NHS Scotland and with our own infection control people here in NHS Highland. So looking at all those rules and regulations, High very much helped us set up a decontamination area really. So it's kind of like a clean, dirty area. So once we've seen our patients in clinic and they return the kit to us, We now have, instead of having those kits in bags as we previously did, we now have them all in boxes which are easily cleansed and wiped down. Every patient gets a box with the kit to be returned to ourselves. Those kits are then stored for 72 hours until we can then take the video and start compiling the video to send that video to our pre-readers. So it has delayed our time lapse. It's given us a bit of a time lapse for obvious reasons, but we still managed to get those reports back into the NHS fairly quickly. So the kits are left for 72 hours before our nurses will then get them all cleaned down, and then we can compile the videos. And it works really well at the moment, and I think it's something that has definitely helped us move forward and enabled us to continue with our process. So the kit's quarantined and it's in a safe environment, and it doesn't really affect anybody else, which is great. And Medtronic, as I've said earlier, if you see the little picture down in the left-hand corner there of your screen, they've recently developed a new belt, which is slightly less cumbersome. It's a lot lighter, and it's also got a single-use cover on it. So the cover on that belt is single-use for patients, and it's disposed of after every use. We still have to use that 72 hours for the rest of the belt and the kit, but at least that whole cover is being renewed, so it definitely lowers the risk of infection for those patients. And I'm now going to hand you over to Reece, and he'll tell you a bit about the AGI.
Thanks, Les. Yeah, I'm Reece. I've been a data engineer for Corporate Health for, I think, just over 2 years now, and I'm here to explain a little bit about the AI project we are involved in. So, going by the CHI mantra of a scaling healthcare service, one of the components we are looking to scale up is the use of AI in our pre-reading step of the internal pathway. So, funded by Innovate UK, and Corporate Health are leading a project that does exactly that. It's called Artificial Intelligence Supported Diagnostics of Gastrointestinal Diseases with Video Capsule Endoscopy. So it's a bit of a mouthful. So we call it AGI for short, AIDGI. These are the guys that we're collaborating with within this project. I believe there's one missing on the right hand side for some reason. It looks like the graphic hasn't been imported, but that's NHS Highland Gem CSU. So we have a range of expertise here, going from AI to software development to data transfer, project evaluation, and everything in between. So today in the pre-reading step, where we are looking to get AI to help us. By the pre-reading step, I mean someone actually sitting down and looking at the video that the capsule produces and picking out any findings that are worth looking at. That whole process takes around 45 minutes to an hour. Obviously not scalable if we're to be getting hundreds of patients. So the use of AI would dramatically increase this time. So I don't want to go into too much detail about the actual neural network because I don't know too much about it. I'm the data guy and kind of time restricted as well. So the technique used in collaboration with the University of Barcelona is a convolutional neural network method. Long story short, this is a filter that's applied over an image or a frame of the video, and it's used to determine features on an image such as colors, straight lines, etc., etc. And from the diagram on the left here, you can see that depending on the finding before, you can then determine further characteristics such as bumps, lumps, folds, and whatnot. So in our case, polyps are a high area of interest. So the more that we feed a neural network images of polyps, the more it will teach itself as to what a polyp, what features a polyp has. And using this part integrated in the previous step, we would hope to get to the projection on the right hand side. So today we have a 45-minute sit down time of looking through the video, and we would hopefully like to get down to shorter and shorter as the network gets more accurate and more productive. The challenge of training a network like this is the lack of data, specifically in this specific area that we're looking at, which is polyps. There's no publicly available data set, so we have to make our own, which is where IM come into play. So the current data that I have to work with is tailored to medical reporting, and rightly so. That's the whole purpose of looking at these videos. So in this case, a polyp might be marked once, but it might be visible for 50 frames or 2 minutes of the video. So my job is to, along with the help of a medical expert who is also got AI consideration, would help me extract those images and then feed that into the network so it can be digested for computer use. Now, it's nearly impossible to get a perfect data set. Like Lesley mentioned, it is 400,000 images that this capsule can capture. We need to manually look at these and extract these based off of what was reported for the original medical report. Now, except we're not going to get it perfect the first time, so at the step here where at the last half of this diagram is where we would feed our initial findings into the network, and then the network would spit out something that says, this wasn't marked in the data set, but it looks like a polyp. Can you please reiterate and re-add to the data set? So it's sort of a help us, help you relationship with the system. So we can make the data set better based on the feedback from the network. Within AGI, we are also creating a couple of tools to both help the dataset creation process that I do, as well as presenting the AI results to the end user. So for the process of the dataset creation, it is quite a laborious task. It's, like I said, it's manually going through images. Our partners in the AGI project, Wolfram, they're helping develop tools where we can actually mark polyps in bulk by presenting it in a time sequential order. And this is going to increase productivity by quite a lot because it's only focusing on the polyp areas itself. So I'm looking forward to that. And for presenting the actual AI results to the reader, our AI specialists in University of Barcelona, they're creating a tool that presents the first analysis of the video back to the pre-reader in a highest confidence manner. So the images that have the highest probability of being a polyp are presented to the user first, rather than the old technique of looking through the video from second one all the way to the end in a time sequence and having to find stuff. The network has found something and presented it to the end user. So the aim of this AGI project, by the end of the project, it was a 2-year project that started last January, so it will end at the end of this year. We are looking to have a system accurate enough for pre-production or to be used in prototypes or trials after the next iteration of the network, as well as optimizing both of the tools I just mentioned based on user feedback for a more productive dataset creation, as well as quicker pre-reading. And then moving forward after the project, the network's getting ever more accurate as the more patients come in, the more videos come in, which means the more images of polyps that we have, the more accurate the network gets. It's simple as that. And the tools themselves should be hopefully in a production level by then, where we can not only automate a lot of the dataset creation process, fingers crossed, we could also have a fully functioning tool for the pre-readers to go from hours to minutes when it comes to patient results, as well as weeks to days for data set creation. Like I said, hopefully. So by looking forward after the project, hopefully AI can become fully integrated into the corporate health pathway and make it a truly scaling healthcare service. Thank you for your time.
That's great. Thank you very much. Okay. Right, we've had some questions submitted to us, but there's still time to take questions as well as potentially take you off mute. One of the first questions that we've had in, you and the CHI team have a great reputation for doing good work. What do you enjoy most about what you do? And that's to that's to Lesley.
I think for me, I enjoy everything about it. It's just a new challenge for me. I think being a nurse, it's about building a team. It's about building a team that work very well together and deliver a gold standard service. It's working with the technology side of the team as well and learning a bit about that, but also letting them help us to scale things up and to make things a bit more doable. As nurses, we like paper and we like to write everything down. and it's learning that we can do lots of that online and it can actually make it much more efficient. But also having like Reece and Ely and Christine, they're all Scottgrad students, and it's really nice to have brought them on board and see them develop as well. So yeah, it's been great. And even like just being in this building, the collaboration is great. So yeah, the whole thing for me is great. I really enjoy it.
Thanks very much. Okay, next question that's come in from the audience. Great presentation, Lesley and Reece. When do you feel that you're going to reach a point when the diagnostic process is fully automated, and just as importantly, clinicians and patients will trust the results?
I think we're getting there slowly, and that has been one of the challenges, because we do have an issue with capsule excretion sometimes, because we don't always get that capsule excreted, within the time limit of the battery life. And I think that we're definitely gaining ground with that as things roll out. And I'm hopeful that, with rolling out through Scotland in the next wee while, we've had 14 or 15 health boards in Scotland that have signed up to do this next phase for COVID. We need to improve the technology. I think there's no doubt about that. And I think that with the current technology, the images are fantastic, but there is a little bit of a discussion sometimes about the sizing of the polyps because of the angle of the camera. And we're looking at things like that all of the time. But more and more, I think people are having a little bit more faith in it, and we're getting much better feedback, and we're understanding it all a lot better. And I think that's what we're all about. It's all about working together to improve it and to get a system that works really well for everybody.
Yeah, I also, from an AI perspective, I don't think we will ever get rid of the human being. I would hope not anyway, because it'd be difficult to. And it's important for me to stress that the AI part to be integrated will be for external use. So the end user, the clinician who gets the medical report, will not be exposed to artificial intelligence. It's just to speed up the reading of the video itself, where there will always be a human being validating what the AI has found. So fully automated, I don't think it might ever get to that point.
Okay, thanks. Right, we'll move on because we've got heaps of engagement for you. Are there any changes that the NHS could make that would make your work more beneficial for them, patients, and for CHI? And that's to all of our panel.
I don't know if it's about the NHS making changes. I think it's about working together, and I think it's about realising that sometimes there is room to take in, private companies, small private companies, or even maybe sometimes larger private companies, but working with the NHS to do something that works for everybody. And sometimes it can maybe be more cost effective, and sometimes it's about staffing and it's about the expertise. But I don't know if it's about making things better for us. I think we are there to try and make things better for them, and I think about trying to look at systems that currently we have a bit more time maybe to look at, and certainly if you're a private company, you've got a bit more time and a bit more ability to have that extra staff in there. Whereas I think, having worked in the NHS for 27 years myself, I know how busy it is, and I know how many jobs each nurse has to do and each doctor has to do, and everything just kind of gets piled on board. Whereas we don't have that problem. We are able to concentrate on one thing. And certainly looking at the ability to work with them, things like honorary contracts and things, they're not a problem, but they take some time to get in place. And I know we're looking at that with the Scottish Government at the moment, and looking at a Once for All Scotland kind of passport for our company, which will make a huge difference. And certainly for rolling out, that will make a big difference in time for the ability of us to see the patients in that timely manner.
Anything to add there, Reece? Are you quite happy with that? We'll move on to the next question, yeah?
Yeah, quite happy.
Okay, right, we're going to take a different angle of a question now. How do you gather all the capsules so they don't go into the wastewater system? If not, what are the implications for wastewater processing?
So they do go into the wastewater system, and they are biodegradable apart from the battery, and the batteries are collected by the sewage works. I actually don't know what they do with them, but that is the ethos behind it. So as long as they go through a sewage works or a septic tank area, most of the capsule is biodegradable except from the battery.
Okay, thanks. Right. From working directly with patients, what's been the feedback from them as to how this procedure has improved, or otherwise their interaction with the medical profession?
Yeah, the patient feedback about the capsule is generally very good. The patient feedback about us not being part of the NHS is also very good. I don't think the patients mind, as long as they get a good service and they recognise that we're working within all the GDPR guidelines and everything for their information. I'm not quite sure if it makes any difference to the collaboration or the interaction they have with the doctors or the nurses, because they have the interaction with us. They still speak to their consultant with further results. The referring consultant still gives them the reports and things in the same manner as they would should they be having a colonoscopy. So to be fair, I don't think there's a huge difference, to be honest.
Okay, thanks. Next question. How has being based on the Inverness campus helped your business?
First of all, the facilities that we're in are superb. From an IT perspective, which is my domain, we've got a dedicated server room that has been able to facilitate crucial workflows of the AI work stream. So in there we have 2 servers, one to they're provided by Intel, one for dedicated for dataset creation, and another one to train the network. So yeah, without that, it would be pretty unlikely that the AI thing would go ahead as a whole.
Thanks, Reece. Lesley?
I think for us, like I said before, it's just really about the collaboration. I mean, we've worked with Hilliard McDonald, we're doing some work with ODX, and the collaboration is fantastic. And I think we all work together very closely up here. There's Aseptium, there's 4C, and we've spoken to them all about various different things, and likewise they have with us. So yeah, the collaboration's been amazing. It's just a really nice place to work.
Well, you've actually just answered the next question. You must be a mind reader. How has collaboration played any part to date? So I'll move on to the next question. And this is around what other countries, what are they doing in this space?
Do you mean as far as capsules go?
Yeah.
Yeah, I mean, I think there's lots going on, and there's lots of research going on, and lots of people developing capsules and belts and things at the moment. I mean, certainly there's a company in China who have developed an abdominal capsule, it's a gastric capsule, and they're looking at, it's magnetic, and they look at that from you go to the clinic, and there's a big magnet which is attached to your mouse, and that you can guide that capsule throughout the stomach to see what's going on there. So yeah, I think there's lots of things going on, and lots of people looking at, lots of research going on, and papers being written. But certainly, I think for us, we are probably the most prominent in Europe at the moment in doing what we do.
I'm not sure where these companies are based, but there are some other companies that are looking at integrating their own sort of artificial intelligence solution with their brand of capsules as well. Couldn't give you specifics, but I know it's a thing.
Okay, thanks. The next question is quite simple, but probably quite tricky. What's the one key thing that has made the difference to where you are today? And that's to both of you.
I think for me, I'm trying to think of one key thing. That's a difficult thing. I think for me, I think the biggest thing is the collaboration, and we are willing, and I think we're always keen to hear what we do well, what we do badly, and we're always keen to try and improve on that. And we will never do everything perfectly, certainly not first time. And I think we're a company who are quite good at recognizing that, and we welcome feedback, and we welcome people saying to us, I don't like this, and we then will work really hard to try and improve on that and make that better. And I think for me, that's what will be our main changing point at the end of the day.
Thanks, Reece.
Yeah, to echo Lesley, the relationships and collaborations that we've sort of blossomed, like we weren't really you could say we're not the biggest company, so it's good to get as many thoughts and ideas from everyone else as we can to expand ourselves, and yeah, get help from other people who know what they're doing better, especially in the IT department as well.
Okay, and our final question that's come in from the audience, and again, it's to both of you. What opportunities are still to come?
Certainly for me, I hope there's lots of opportunities still to come. I hope that capsule development and the recorder and the belt and everything develop hugely. And I think that certainly for me, I mean, my brother died of bowel cancer when he was 39, and I think I'm quite passionate about the fact that if we can do anything to try and help to flag up or eradicate bowel cancer or pick up bowel cancer quicker, then that's certainly something that's well worth doing. And I know I've certainly spoken with Professor Watson and sort of some of the other consultants and some of the guys in our company and James Cameron from High, and I think the goal eventually would be that we could maybe have some kind of system that works well enough that maybe it's a capsule that you get through the post that's your bowel screening test, and I think we're many years from that yet. But I certainly think that with the developments that and the collaborations that are going on and the interest that's being shown at the moment, it's certainly something I think that's worth looking at and hopefully trying to develop.
Thanks, Lesley. Reece?
Yeah, and from the opportunities already there, for my point of view, is that the thousands of patients that we're looking to do, obviously for AI, that means a lot more training and a lot more accurate of a network. So really the sky's the limit, and AI is sort of the new buzzword. So anything that incorporates AI is an opportunity in itself.
Well, I'd just like to thank you both for answering the questions, and also to the audience for submitting some cracking questions. Now I'm going to pass back to Andrea.
Thank you, Jai, and thanks, Lesley and Reece. That was really, really interesting, and it's always great to hear about what you do and how fascinating it is, you know, working with the patients and also having the artificial intelligence being developed at the same time. So just to close off, just wanted to remind everybody in the audience that we're keen to get feedback on today's webinar and also on any other people who you would like to see maybe in a future webinar. So please use the opportunity to feedback directly through the GoToWebinar system or through our SurveyMonkey link. We'll be sending up a follow-up email with that survey link and also a recording of today's session. And please feel free to share that and pass it on to others who you might think might be interested in seeing it. We've also got our next webinar already planned for the 3rd of September, and we'll have Kate McDonald from Capella IP speaking to us then about intellectual property and how to use it to your advantage as a business, really, in maybe different ways to what you usually think. So quite excited about that one. So please keep an eye out for your invitation on social media advertising that closer to the time. But yeah, thank you again, Lesley and Reece. It was great to have you on the webinar today, and hopefully see you all in the audience soon for our next one. Okay, thank you.
Have a good day, everyone. Bye-bye.